Hey guys, Dr. Joe here. So today what I wanted to discuss with you is scapular motion. What I mean by scapular motion is your shoulder blade. So on occasion, your shoulder hurts because your shoulder blade is not moving well. It could be a normal thing with people with horrible posture, or they hurt their shoulder, pain in their mid-back, and it causes the scapula, which is our shoulder blade, as it rocks over our thoracic spine to get caught. And when it gets caught, it causes more pain into your actual shoulder joint. So if you can see this graphic over here behind me, so this is your shoulder scapula right here that's sitting on top of your rib cage in the back. So as you raise your arm up, your shoulder blade has to actually, let's go on this side, your shoulder blade actually has to pivot, going up and down with your shoulder bone, with your humerus bone. If that shoulder blade, okay, is caught anywhere along the mid-back region with tension, soreness, hold muscle, postural stress, that scapula can't rotate nicely, and it puts more pressure onto the shoulder joint. Okay, so you need to get your scapula working better to reduce the pain in your shoulder. All right, so these areas can be assessed and by movement patterns and functional movement screens to determine the mechanics of your shoulder blade, if it's tilting, if it's arcing properly and moving up and down, and you could reduce the tension off of your joint just by working on your scapula. So for those of you who do a lot of bench pressing or just shoulder workouts or just having shoulder pain in general, it's always advised to get your scapula worked on to reduce the stress around the area. Unfortunately, just stretching alone won't solve this because it's hard to stretch at the muscles behind your mid-back and around your neck all at the same time to increase the motion of your shoulder blade and allow it to have more freedom of motion. These things have to be treated by a healthcare professional so that way they can assess the motion, determine if it is the problem, and then release the surrounding soft tissue work around it and allow for proper motion to occur. So if you're having any shoulder pain, or if you feel just pulling in your mid-back as you're moving your shoulder, going through exercises or doing anything else, you should get your shoulder blade or your scapula looked at to make sure it's gliding nicely. If you have any questions, let me know. I'd be happy to help. Thanks for watching.